Hi friends, today we are going to discuss about the vincent infection. So before going into the disease, we have to know a little bit about the anatomy of the oral cavity. So oral cavity is divided into oral vestibule and the oral cavity proper. Let us just keep the oral cavity proper aside and the vestibule is what we needed here. So let's look into the oral vestibule. As you can see in the picture, oral vestibule is a space between externally your lips and cheek mucosa and internally it is teeth and gingiva. So when you check into that gingiva, you can see there is an elevation. That is your nothing but your gingival margin and the space between those two teeth it is gingival papillae or you can call it interdental papillae. Okay, friends, back to our topic. So, Vincent disease, another name is acute necrotizing ulcerative gingivitis. The name itself is telling all the story. So, gingivitis is the inflammation of gingiva which causes ulceration and the necrosis. So, the causative organism of the Vincent disease is Fusiform bacillus and spirochete, especially Borrelia vincenti, and it affects young adults and the middle-aged people mostly. Okay, then next it is the clinical features. Usually, it starts at the interdental papillae. I told you the space between the teeth, and it spreads to the gingival margin. Okay, then this gingival margin eventually covered with the necrotic slough. Then another clinical feature is the gingiva is becoming red and edematous. Okay, and this Vincent infection can spread to your tonsils and it may produce the ulcer and necrotic membrane over the tonsils. Okay, and remember, this tonsil is a part of your oropharynx. Look at the picture over here, and you can see all those clinical pictures clearly. So the reddened edematous gingiva and the necrotic slough between those interdental space. And how we are supposed to diagnose this? It is easy. We will make a smear from the affected area. We will find out the causative organism. And lastly, how do we treat these patients? So first, it is systemic antibiotics. Remember the names penicillin, erythromycin, metronidazole. These are the antibiotics we usually use. I know it's not a big deal to remember this, but I have a funny way to remember this. Just think this Vincent guy, he's a super naughty guy and he always throw pencils at some random metro. So it's like metronidazole, penicillins, erythromycin. Okay. Then next thing is the frequent mouthwash with sodium bicarbonate solution, and they have to pay more attention to their dental hygiene. So that's all about our Vincent infection. Hope you understood. Thank you.